coronary bypass grafting, there's two major vessels that usually are harvested. We don't have to know a ton of detail on this, but I do want to bring it up because it comes up in board questions and you just want to be familiar with this. So the internal thoracic mammary artery, can be just called internal thoracic, can be just called internal mammary artery. It's a branch of the subclavian. So you can see subclavian here. It's coming straight down. Okay, this is the preferred usually artery that's taken for grafting. And again, we do coronary bypass grafting because we have an area of stenosis in the heart and we're trying to get around that area. And typically, if we're going to do grafting, there's usually multiple vessels involved or a major vessel, like one of the vessels we talked about in the last video, the LAD or the widowmaker, the left anterior descending artery. And so in some cases, we can bypass that artery, harvesting another artery in the body or another vein. So the main artery, like I said, is the internal thoracic artery. The primary vein would be the great saphenous vein. And you don't have to know all the details as to when you would use one or the other, but you should just be familiar with these two as your primary structures that are harvested. Now the great saphenous vein, just because, again, these can get turned into anatomy questions, the great saphenous vein is going to be running mostly on the medial foot. It's going to run kind of along the medial malleolus, along the medial leg, and then it's going to come up through the medial thigh. Okay, so just to kind of be familiar with where these structures are at.